So today, Dr. Scholes, I thought we would talk about a concept that has come up in the comments section time and time again. When patients are facing the big decision of choosing a treatment, I think oftentimes, there's so much media, there's so much going on in prostate cancer where you have news outlets coming out about the latest and greatest treatment, and then you have studies showing that older treatments have still a lot of, power and that we need to pay attention to them. And it's really hard, I would imagine, going into this situation where you're wondering, should you do something and choose a treatment that has the latest technology, or do you do something that is, tried and true and has been around for a long time and you can see like 20-year outcomes in the studies? So when you have a patient coming into your office and they're facing this dilemma, what's kind of the first steps that you take?
Well, I think you've outlined this challenge that we have balancing off treatment results with treatment side effects. And the problem isn't as difficult when you're dealing with the extremes of prostate cancer. Some men have these really harmless cancers, grade 3+3s that'll never spread, and we can confidently push them into active surveillance and toxicity is minimal or non-existent. And then we have men at the other extreme that they've got diagnosed late. Their PSA is 100, they have spots, metastatic spots, and in that situation, it's not very controversial either. I mean, you want to use every available treatment within reason to eradicate all the disease. Where it becomes more challenging is in the middle, where the disease isn't that serious, although in theory over a number of years could become serious. Treatments that we've had historically for treating that have not been optimal. Most of the treatments for localized disease are aimed at eradicating the whole prostate, and consequent urinary and sexual problems, sometimes rectal problems, can be lifelong. And then you're into a balancing act. And this is where the challenge is in that gray zone in the middle, intermediate risk prostate cancers, and sometimes high risk prostate cancers, with new technology coming in that allows us to mitigate some of these side effects. But are we taking a chance with their long-term outcomes of these patients because maybe we've softened or tamped down on the treatment intensity to minimize side effects? But we don't have long-term studies yet with these new technologies. And so that creates ambiguities.
Before I get to my next question, I just wanted to ask you to subscribe to our YouTube channel. 70% of the people benefiting and viewing our videos are not subscribing to our channel. And if you do that, it'll help YouTube know that we're a great resource for patients who have prostate cancer, and it'll get our videos out across this platform at a much better rate. So please subscribe. Also, if you would like to donate to PCRI, we are a nonprofit, you can do so at pcri.org/donate, and this helps us create even more content just like this. Now back to my conversation with Dr. Scholes on the newest and greatest versus the standard of care. What are kind of the concepts that you wish patients would hold in their mind when they are deciding upon this? Because it's such a balancing act. You want the treatment to be effective, as you've said, but you also want the side effects to be manageable. And if they are present, for them to have ways maybe to be lessened to certain degrees with other medications or things that you can do. And then there's the living with it. There's the living with cancer on a day-to-day basis, and then the long-term outcomes. So really, when it comes to that, I think that a lot of times there's so many different facets to the decision-making process. For active surveillance patients, a lot of times the family members have issues with them, just watching cancer. For advanced patients, a lot of kids, read up on it and they're going, wait a minute, Dad, why aren't you getting this latest technology and this new thing? What are the pivotal points that you wish just patients would see very clearly as they start this journey?
One is to understand what you're talking about, that prostate cancer isn't one thing, and that sounds sort of obvious, but in the rush and the fear and the anxiety and the uncertainty, there's this general sense that that all cancer is inevitably going to turn out to be a bad story. And that's understandable given how dreadfully dangerous most cancers are, lung cancers and bone cancers and brain cancers. But prostate cancer is a much slower growing process and much less likely to metastasize. And so this idea of a spectrum of disease, people typically call it just staging. What stage? In the prostate world, we divide them up into low, intermediate, and high risk. That's the stage of the disease. And if people lose sight of that, they're in trouble. That is this idea of, get it out at any cost. It's cancer. I know what cancer is. You're going to suffer as a result of probably getting over-treatment or under-treatment. So staging a big issue and realizing that you need precision in that. Even after you think you know the stage, biopsy's been done, PSA's been evaluated, you can get errant PSAs. You can have misassigned Gleason scores. Absolute precision on the stage first, so that you're starting from a strong foundation of knowing what you're treating. Absolutely essential. Otherwise, you're going to get pushed and pulled emotionally into whatever the most recent or most charismatic doctor tells you to do.
So when you're talking about, confirmation of prostate cancer, and I've heard you talk about this in other videos, you also talk about getting second, third, fourth opinions. Can you talk about the importance of that in this particular scenario?
Well, I think it's important, particularly when you're in that middle gray zone, which is very large in prostate cancer. And when we're at the extremes of very favorable or very serious, then the situation is not likely to change much with second or third opinions. You know where you stand. Then you go on to the next level of what treatment will you undergo and who's going to administer that treatment. There certainly can be a skill factor in the selection of treatment and in the administration of the treatment. And that's always a challenge in terms of finding optimal doctors. Simply going to a famous institution is no guarantee that you're going to get optimal treatment for your prostate cancer, because many of these institutions have agendas of getting certain research done. It's inevitable that the physicians are going to position themselves as your advocate. That's just kind of doctoring 101. As I'm on your side, I'm going to be here for you. What can I do to help you? I mean, it's particularly bad in the HMO world, where they're employed by an insurance company that's designed to save as much money as possible. The selection of who's going to help guide you in the treatment and who's making these recommendations is another critically important component, and it's not easy to find that resource that's really on top of their game and ultimately pursuing the optimal outcome for the patient as opposed to some other agenda.
In other videos that we've filmed, we have talked about the concept of finding a good physician and the interviews that you have to do, getting those second, third, and fourth opinions. You interview a medical oncologist, not just a urologist. You interview the, radiation therapist. A couple of things that I've heard have helped other patients, and you and I have talked about, is, finding out how many procedures they've done. Are they really new to this type of procedure that you're looking into? Have they done 20 or have they done 2,000? And then also, reading the reviews and talking to other patients about their outcomes. I think that's why support groups are so important, is for patients to be able to talk to each other and find out, yes, I had a good outcome, or no, don't go to that guy. Maybe his bedside manner was off or something to that extent. Also, if they've written papers on these topics, and how well do they know the topic? Are they working for one specific company? Or, how finding out kind of the biases as well, as you've mentioned, in these medical systems. I think that it is quite scary at times to find the right physician, because you're wanting to get that optimal outcome, but doing the research and taking the time will just give more patients confidence over time, which I've seen time and time again. And so I appreciate you bringing that up, because I think it's incredibly important, and I think it's kind of a not a concept that's brought up in prostate cancer a lot of times, because patients just tend to go to the doctor that they're assigned and they stick with that person. Maybe they build up some emotional connection, and maybe that's not the optimal person for them. And so definitely advocating for yourself in that stage is really important. Now, defining staging for the type of prostate cancer that you're talking about, really this gray zone. So you have the 4+3s and the 3+4s, where patients are kind of like on the cusp of active surveillance versus treatment, and vice versa. So when it comes to that gray zone, and when it comes to deciding upon treatment, how many procedures should a doctor be doing in order to be practiced? What type of research should the patient be doing in order to find out their options?
Let me revisit just something you said just briefly, and that I think can be encapsulated in the idea that the doctor, at least in the prostate realm, should be serving the interests of the patient. In other situations, you're going in for a gallbladder operation. He's a well-vetted surgeon. It's a good hospital. You submit to the process. In the prostate world, in the gray zone, we have the impact of treatment on your sexuality, your day-to-day urinary function, your longevity. All these things are mixed in. And I think that the decision-making process starts now to rest more on the patient than on the physician. And that means that you as a patient need to be not looking up to this physician as the last word. I hope they're worthy of respect and they're the best. That's what we want. But even so, even though they may be in the top of their field, the buck stops with the patient in the prostate cancer world much more than it does in any other realm. And since that is the case, patients need to be looking at their physicians, respectfully of course, but as their servants to help them, the patient, make a decision. And that's a shift in responsibility, a shift in power that's somewhat unusual in the medical field, but very common in the prostate field. Addressing this gray zone, you mentioned the 3+4s of, I think probably the most salient thing to discuss is that if you go back 10 years, 3+4s, Gleason 3+4s, were universally treated for cure. And that was because of concerns about metastasis, and you have to eradicate the disease. But we're finding out now that many 3+4s have a very low metastatic potential. And in the field of prostate cancer, we really haven't come up with a harmless treatment to eradicate 3+4. The doctors are still doing radical prostatectomies and whole prostate radiation, and these things entail significant long-term consequences. So I think that's brought more ambiguity, even more ambiguity, into this field, that it's not as black and white as it used to be, that if it's 3+3, we watch it. Anything above 3+3, you treat it. It's something that we need to make the public aware of because the industry has been slow to move away. This is an industry primarily of surgeons and radiation therapists who are thinking of treating people, not watching people. It's just what they do. The reality that 3+4 is now, in many cases, can be monitored rather than treated.
So when it comes to, the newest and latest technology, how long should those studies be done before, or what should we see as far as the product of that new technology in order for us to say that this is, a definitively good treatment? Like, what should patients look for? Because I think a lot of times we read things on the news and we see that it's focal this or focal that, or maybe this new ablation, and we're kind of going, oh, it's new, it's exciting, it's the latest treatment. And oftentimes it may not have the best results.
This is a common problem we're having in our modern world. Technology is moving so quickly now that we don't have time to vet the long-term outcomes because in interim, a new technology will come up and replace that one. And we're seeing that now in the medical world. And so how do you manage all that ambiguity? Well, I think it's always looking at the risk-benefit ratio. If you look at standard care and what the risks are associated with that, or you look at a new treatment and you say, well, the advantages of this new treatment are that it has potentially less side effects, but is it also associated with lower cure rates? An analysis, you say, well, cure at any cost. Well, not in the prostate cancer world. We know it's a low-grade process. So cure at any cost makes sense for other cancers, but it doesn't make sense for prostate cancer. The analysis then has to come about in terms of, well, how much increased risk of a loss of cure rates and how much reduction in side effects are we achieving with this, and how does it balance out? If you're getting a gigantic augmentation in side effect reduction, and you're maybe paying a small price in terms of cure rates, then that may be attractive. If, on the other hand, you're getting a big drop in cure rates with only a small incremental decrease in side effects, then you're probably not making a good choice. So we're talking about probabilistic constructs. This is very sophisticated stuff. And the PCRI talks about researching your options. The idea, of course, is to start with accurate information. We opened the video talking about getting accurate stage, so you know exactly what you're dealing with. And then you can look at all your different options and look at the pros and cons, expected cure rates, expected toxicity, and compare these different options in that light, doing the best you can, because in many cases we don't have long-term studies, but we do have reviews and doctors' experience and other patients' experience, and then all these things need to be weighed. I know it's a complex thing, but it's not surprising when you're dealing with an illness. It's at that tipping point of, do we even need to treat it? We're talking about, where will you be 10 or 15 years from now? How is that ever an easy question? If you're trying to invest for 10 years from now, there's so many uncertainties in the world. In the prostate world, we don't know what new developments are going to come. 2 or 3, 5 years from now, we have a simple, easy treatment, and you've already had a radical prostatectomy. You say, well, that ship has sailed. I'll never be able to avail myself of that new treatment. I bet now in the present on a radical treatment. As I've said many times, prostate cancer surgery is a super high-risk methodology, so in terms of its impact on quality of life. So there's plenty of motivation to spend the time and work through this process. And fortunately, prostate cancer being a slow-growing proposition, you do have time. It's a lot of work, and you're learning a whole new field, but the stakes are high, and they're worth it.
I think that's something I wanted to highlight is the fact, you mentioned the cure at any cost, and then you mentioned prostate cancer being slow growing. One of the videos that we filmed a couple months back that did really well was the timing of prostate cancer. And you talked about that even in Gleason 9, high risk categories, that patients still had months to do their research, find what options really were responsive to them. They wanted, this is what looked good to me, this is who I trusted, this is a physician that I liked, and they had time to do their research. I think that patients, even in the comment section when they watch these videos at times, they say, oh, well, you're being flippant, I was diagnosed with metastatic disease. The thing that we're presenting here is that there are different types of prostate cancer, and I think that that's always the number one thing to keep in mind when you're watching these videos, is this video that you're watching talking particularly to your type of prostate cancer? When you're talking about the cure at any cost versus the side effect ratio, you're not talking about people who have mass metastasis and they need to get treatment a little sooner, and we need to get them to that stage, as you've mentioned. And you're also not talking about the cure at any cost really being in Gleason 6 prostate cancer that can be watched, because you don't want any side effects if you have Gleason 3+3. You can watch that cancer, and Gleason 3+3 is not going to turn into a different type of cancer. It would be a new tumor type that would come in. And so I really appreciate you clarifying that, because I think it's extremely important for patients to take the time as they research their options to go back to what you originally said and find out what particular type of prostate cancer they have in order to really weigh their options. And even in the advanced categories, you still want to have time to do your research, and they do have time, and find the right person in those metastatic cases. So today I talked to Dr. Scholes about comparing and contrasting the standard of care, the tried and true, versus the newest and latest that we've seen come out as far as prostate cancer treatments. Now, as he's mentioned, prostate cancer treatments are coming out every single year. We've seen something new change in prostate, PSMA, or a different type of drug combination, or maybe a new oral treatment, hormone therapy, focal radiation. There's a lot happening in prostate cancer. Now, that's exciting, but it also makes it very difficult for you as the patient to be able to make the right decision when it comes to your treatment, because there's so much information, there's so much news, really what's the best. So here are some, summarizations of our conversation with Dr. Scholes that I really hope are helpful. Number one, take your time. As we've mentioned, even in advanced categories, you still have a couple months to make that decision. Number two, talk to multiple physicians and get second, third, and fourth opinions. See who you trust. See the person that is really fitting in with your priorities. Now, I know that I have mentioned from time to time that prostate cancer is like a chronic disease. I'm not saying that in any way, shape, or form to minimize the severity of its outcome, having cancer, and it being life-threatening. What I am doing is bringing light to the concept that because prostate cancer tends to be slow-growing, and you do have some time, even in advanced cases, to decide upon that, the other thing that is important to remember when it comes to the concept of chronic disease is the fact that you'll have to live with the outcomes, because prostate cancer treatments tend to be pretty effective. And so you're going to have to live with the outcome of whatever treatment you choose. Now, you may be saying, Alex, of course I know that already. Of course somebody has to live with the outcomes. That's obvious. But there's sometimes outcomes that we know about and outcomes that we don't know about. And so doing your research ahead of time is really helpful. Because I've talked to many, many patients, and sometimes they would have decided upon a different type of treatment or a different way of monitoring. Like, there's all sorts of, different ways to do things, but maybe they would have decided upon something different if they had known that the side effects that they would be suffering for the next 15, 20 years would be as great as they are. Again, we want to mitigate side effects but get the best cure rate possible. The best person to measure that is your medical team, with you being the quarterback for your own medical team. You want to be the one who's doing the research, who is advocating for yourself, and not just saying, yes, this is the right treatment because this doctor said it. No, weigh the outcome and weigh the costs. Another thing to do is to get other people who have prostate cancer around you so that you can hear their different opinions. We talk about support groups quite often, but I do think it's very important. And get your family involved and really get as much support as you can, both mentally, emotionally, physically, when you're going through this process. No matter what type of prostate cancer you have, it is still very intense being diagnosed with it and having to deal with that burden. And we want to make sure that you're getting as much support as possible. Speaking of support, if you would like to, you can call our helpline at pcri.org/helpline. You can fill out the information on the website, and somebody will call you back who can help you formulate information. And this information is really what you go to your doctor's appointments with, and you say, okay, I have this information about this study or this treatment or this side effect. How can you help me through this process? Because I would like to optimize this outcome. And they can help you kind of customize that for you. So again, you can do that at pcri.org/helpline. Now, please remember that you're not alone. We really appreciate that you trust us, that you watch these videos. All of this is information, not advice, and we want to make sure that you're really being empowered to make the best decision for you. I hope you have a great week, and we just thank you for watching.